My name is Vivian Kopsinger Birchall, an American immigrant from Uganda, and my project is addressing barriers to screening for cervical cancer in Uganda. But first, let's take a look at global cervical cancer trends. Cervical cancer is caused by the human papillomavirus and, according to the CDC, is the most common sexually transmitted infection in the United States. According to the World Health Organization, comparatively, cervical cancer is the fourth most common cancer among women, with 660,000 new cases and 350,000 deaths recorded in 2022. The highest rates are in low and middle income countries. Here is a chart showing the ratings among low and middle income countries. In 2020, Uganda was ranked seventh in countries with the highest rate. Electa Foundation works with low and middle income countries to increase the HPV testing and cervical cancer screening. The president, Lacey Hubbard, shares some compelling statistics.
Every 2 minutes in the world, a woman dies from cervical cancer. So the idea of eliminating cervical cancer is early detection, early screening, and early treatment.
Dr. Will Ngwa, the director of a global health organization called the Global Health Catalyst, working to bridge disparities in cancer care and treatments, talks about the urgency in Africa.
So in Africa, we believe that there'll be about, the estimate from the Lancet Oncology Commission is that by 2030, we'll have about 1 million cancer cases, deaths per year, right? And right now we have about 550,000, more than that, deaths per year. But because of COVID and other factors, we actually underestimating, because right now, like you and I discussed, people even die of cancer and don't know they are dying of cancer. As we get this awareness that you're creating, people get aware about it, you realize that there are more people dying. So it's a pandemic worse than COVID. If we really have to look at the COVID-19, just based on how many people is killing, we need to bring that same urgency to cancer. And so, in sub-Saharan Africa, from those statistics, there are about 120,000, cases per year for cervical cancer. So it's second after breast. But in terms of death, we 70% of those, about 70% of those with cancer die. And so that's about 80,000 women dying per year.
This urgency is shared in Uganda, where cervical cancer has the highest incidence of women related cancers. It also has a 66% mortality rate in the country. There is a shortage of healthcare providers and facilities to manage this huge disease burden. I visited the country's only comprehensive cancer institute last summer and learned that there were only 4 radiation oncologists and 3 linear accelerators for treating cancer. This is not enough to handle 8,000 new patients a year who come to the center, as Dr. Kavuma describes.
Cancer Institute receives like 8,000 new cancer cases. So out of these, 40% are cervical cancer.
I witnessed the inadequate resources that are serving all the patients. I saw crowded rooms with people receiving chemotherapy, people lying on floors, long lines in the waiting areas, and with the exception of a few new machines, many were old. This is not surprising with a country that spends only 4% of its GDP on health, with 15 physicians per 100,000 patients and only 50 beds per 100,000 patients, compared to the USA or the world average. The country also has 26% of its population, or 47.7 million people, in urban areas, which means 70% live in rural areas and 21.4 live below the poverty line. What does this mean? This means that the largest population in the country depends on rural health centers that are not equipped to manage complicated and late cancer diagnosis. I chose to show these pictures of a health center because it is in the town I went to junior high school and high school in. Every woman who is diagnosed with late stage cancer is referred to the only comprehensive cancer institute, which is already overwhelmed. So, early screening is key. This is why we need a solution to address the poor screening, late diagnosis, and ultimately high mortality, especially among people in rural areas. The project is a media platform that is mobile accessible, creates literacy around cervical health topics to reduce fear and encourage early screening both in rural and urban areas. The culturally centered videos are created to be relatable, to provide guidance on when women should seek medical attention, where to find services, and provide answers to frequently asked questions. They are also designed to be shared by healthcare workers and women in Uganda. The short videos illustrate the key issues identified during interviews with women and clinicians in Uganda. Through the interviews, we learned that some of the factors keeping women from getting screened from cervical cancer are related to stigma of being seen naked and discomfort with gadgets used. It was important to create videos specifically addressing this stigma. Ruth and Esther's stories shed light on different issues and concerns about the process. Let's take a look at Ruth's story. Ruth has not had a pap smear before. What does she have to say about this?
I don't remember doing the cervical cancer training, but I know definitely someone has to go down there. So I guess you have to prepare yourself mentally. Make sure maybe you're not in your period. Make sure you're clean. You everything down. Yeah, you know what happens. You know those areas, like especially like when you if you're married, different people like those areas to be in a different shape. So you'll find that I will not be very comfortable because maybe I don't feel that I am fit to be looked at. I don't want to be judged, but the reason why I am that way is because maybe that is what my husband wants. And then you find another person, they go, they I think you understand what I'm trying to say. So it's basically how you present yourself, how you feel, how you feel that you feel whether you're really fit enough to be seen or you're not.
Another fear that Esther, who has done a pap smear, initially had was the fear of a large metallic object being inserted into her.
My first experience, I had refused after seeing the gadgets. I was like, no, I won't handle. And the doctor's like, no, be easy, be calm, just stay calm, and everything will be okay. So the first experience was a bit uncomfortable, but after knowing the dangers of cervical cancer, of course, I would gladly go again and do the third screening because this is a cancer that you don't feel pain when it's starting, but by the time you realize you have the cancer, it's in the last stages.
So, the target group for these videos is women like Ruth and Esther who are between the age 15 to 54 because it's a sexually active group of women. This group is approximately 11 million women. They mostly share information amongst themselves through social media like WhatsApp, and this digital intervention has the potential to reach a wide population without geographical, weather, and other barriers to accessing information. So, what is the intended impact? By shedding light on the critical issues surrounding cervical cancer in Uganda, including the alarming high incidence rate and late stage diagnosis, awareness is raised among stakeholders, prompting action and resource allocation at a family level for early screening. And addressing The prevalent panic and misinformation surrounding cervical cancer diagnosis within families can lead to more informed decision making in support structures, reducing unnecessary fear and stress. By acknowledging and sensitively addressing women's fears, particularly regarding screening and potential diagnosis, the project aims to dismantle psychological barriers to seeking healthcare, thereby increasing participation in HPV screening programs. Ultimately, the overarching goal is to facilitate early detection and treatment, thus improving patient outcomes and saving lives. Additionally, by empowering women with information and support, the project contributes to fostering a sense of agency and confidence in navigating the healthcare system, leading to improved overall well being within the affected communities. Why did we choose a digital intervention? Even though Uganda is a low income country, mobile usage is high, with a registered mobile cellular subscription of 30 million users in 2021, according to the CIA fact sheet. However, Data Portal has an updated 2024 figures of 33 million, which is approximately 67% of the population. This does not necessarily translate to access to internet connectivity, but it's a good starting point. There are barriers to women's screening that are addressed in the video education series, but solutions may not be available yet, and some require international intervention and collaboration. For example, one recommendation is for global actors to partner with the government of Uganda, Uganda Cancer Institute, and local health centers to roll out HPV self sampling, which would address the stigma associated with women exposing their genitalia to healthcare workers. Would a less invasive option make women more willing to take preventive measures? Well, it has worked, or it is working, in Rwanda, where Electa Foundation is partnering with the government to screen women in rural areas. Take a listen at the statistics.
Every day, we have 500 to 600 women coming to their local health centers, like local health posts, to participate HPV testing.
If women in Uganda participated in HPV self sampling testing and cervical cancer screening in similar numbers to complement the government's vaccination campaign rollout for the younger age group, women's lives could be saved due to early screening, diagnosis, and treatment. However, with funding, it is important to continue building the platform and translating cervical cancer education in local and international languages. Why international languages, one may ask? In Uganda, there is a high population of refugees from neighboring countries, with the largest population from South Sudan and the Democratic Republic of Congo. And all these refugees use the same healthcare system. This slide shows the project's social media campaign planning, and it will be provided for those who want to know the details about the campaign objectives, target audience, content creation, platform selection, and performance measurements. Now I'll talk about the stakeholders who will be interacting with the media. In Uganda, the project is targeting women aged 15 to 54 and clinicians, and will eventually be rolled out to community health workers. This project has potential expansion globally. Two possible explorations for partnerships are Electa Foundation to create content around HPV self-sampling tests in Rwanda, Global Health Catalyst, who have a comprehensive cancer center in the cloud and are working with the White House Cancer Moonshot Office to expand the goals of the Cancer Moonshot globally.